Hello, I am Melissa Allison Crosby, and this is my teaching presentation on ultrasound-guided peripheral IV insertion training for nurses in the emergency room. Peripheral IV access is often an important component to emergency department patient care. Failure to obtain peripheral IV access can cause a strain on the nursing staff, the emergency department physician, delay diagnosis and treatment, and expose the patient to the pain of multiple IV attempts and the need for central venous access. Ultrasound has been shown to facilitate peripheral IV placement in emergency department patients with difficult IV access. This project is aimed at developing a training program for emergency room nurses to learn how to place peripheral IVs with the guidance of ultrasound. The importance of this training course is to increase the knowledge and skill level of the emergency room nurse by teaching the skill of placing a peripheral IV with the guidance of ultrasound in those patients who present to the ER with a known history of difficult IV cannulation or those patients whom have had multiple failed IV attempts by the ER nursing staff. This training course will be held in the teaching classroom with a doctor and a nurse who are experienced with placing ultrasound-guided peripheral IVs as instructors. The training course is limited to the amount of ultrasound machines and practice arms available. Only 2 nurses or students of the course per machine and arm are permitted for successful completion of this course. At the end of the course, the nurses will have the knowledge and skills to successfully place an ultrasound-guided peripheral IV on his or her own. However, the nurse must be supervised on 3 successful attempts prior to performing the skill on their own. The training course is 3 hours in length. If the instructors feel that the student needs more training at the end of the course, the nurse, the student, will have to retake the course at another date. What is ultrasound-guided peripheral IV insertion, and why do nurses need it? You have an IV catheter and an ultrasound machine. If you put those 2 together, you have an ultrasound-guided peripheral IV insertion. Ultrasound-guided peripheral IV insertion is used when traditional methods of IV insertion have failed or when the patient is known to be a hard stick. Common reasons for hard sticks: diabetes, cancer with a history of chemotherapy, cardiovascular disease, end-stage renal disease, COPD, mastectomy, contractures, pediatric population, hematomas, obesity, drug abuse, dark pigmentation of the skin, hypotensive or dehydration status, history of multiple venous cannulations. Dehydration, morbid obesity, history of chemotherapy, and drug abuse are the most common reasons for difficult IV cannulation. The lack of visual or palpable venous anatomy is also a reason the nurse is unable to obtain a peripheral IV. Just how common are hard stick patients? Ah et al. Reports that 23% of patients have veins that are difficult to cannulate by traditional techniques. Why do patients need IVs? There are several reasons: diagnostic radiologic testing, the administration of fluids or medications, the administration of blood products, traumatic or emergent situations. When the nursing staff is unable to obtain IV access after multiple attempts, this causes physical and emotional strain on the nurses. Long ER wait times, which causes stagnation in the emergency department and a decrease in patient flow. It can cause physical and emotional stress on the patient. It increases the anxiety experienced by the patient from multiple cannulation attempts, and it increases pain experienced by the patient from multiple cannulation attempts. It increases the cost that the patients incur. It may lengthen a patient's emergency department stay, and it wastes medical supplies. Multiple failed IV attempts may also require the emergency department physician having to place a central venous catheter, which includes triple lumen catheters, PICC lines, implanted ports, or the use of intraosseous devices. Stein et al. Reports, once nurses are unable to place an intravenous catheter, the responsibility to obtain intravenous access typically is the emergency physician's, which can be a time-consuming process and can slow efficiency. How does training nurses to place ultrasound-guided peripheral IVs benefit the emergency room nurse? Ultrasound-guided peripheral IVs had a higher patient satisfaction compared to the traditional technique, was twice as fast as the traditional technique, and significantly decreased the number of skin punctures. Ultrasound-guided peripheral IVs also improves patient healthcare outcomes, improves patient satisfaction, and improves nursing practice. How does training nurses to place ultrasound-guided peripheral IVs benefit the patient? According to Aw et al., it decreases the need for central venous catheter placement in 85% of difficult IV access patients. And according to Lamperti et al., it is associated with fewer immediate complications, faster access, and reduced costs. How does ultrasound-guided peripheral IV insertion benefit the patient? It prevents the requirement of more expensive and higher-risk IV procedures like triple lumen catheters, intraosseous access, implanted ports, and PICC lines. The teaching strategy of this course includes a 3-hour hands-on instructional training course for emergency room nurses with at least 1 year experience. The introduction to the ultrasound machine will be covered, review of the vasculature anatomy of the arm, using the probe ultrasound to differentiate between veins and arteries, and the insertion of peripheral IV using the probe and ultrasound. After successfully completing the training course, the emergency room nurse will be able to identify and gather resources needed to successfully place the ultrasound-guided peripheral IV. The emergency room nurse will be able to demonstrate the proper procedure of holding the ultrasound probe against the skin, which includes orientation of the probe to screen and horizontal versus vertical views. The emergency room nurse will be able to identify the vessels of the arm and differentiate between a vein and an artery using the ultrasound. The emergency room nurse will be able to use the gain, focus, and depth controls correctly on the ultrasound to obtain the best picture of the vasculature anatomy of the arm. The goals of this training course are, after successful completion, the emergency room nurse will instruct the patient on the need for an ultrasound-guided peripheral IV insertion, explain the process and the alternatives to the procedure. The ER nurse will successfully coordinate the probe and the IV insertion on a practice arm. The emergency room nurse will successfully demonstrate the proper use of the gain, depth, and focus features of the ultrasound machine while inserting an IV on the practice arm. The emergency room nurse will successfully explain the difference between a vertical view and a horizontal view and what situation to use these views. The emergency room nurse will successfully place 3 ultrasound-guided peripheral IVs on a patient to pass checkoff of this skill. Introduction to the ultrasound machine would include the different parts to the ultrasound machine to include the screen, the probes, the depth, focus, and gain functions. Instruction on how to properly hold the ultrasound probe using the C-hold and how to line up the probe to the ultrasound screen machine using the dots is an important concept in placing ultrasound-guided peripheral IVs. Review of the vasculature anatomy of the arm is very important to determine which veins to cannulate. Beek et al. Reports the best superficial veins for peripheral IV access or venipuncture access are referred to as the antecubital veins. The median cubital vein is the first choice because it has a large diameter, is well anchored to surrounding tissue, easy to access, and the least painful site for the patient. The cephalic vein is the second choice. While it is often more difficult to palpate, it is well anchored by its surrounding tissue. The basilic vein is the third choice because it is easy to palpate. However, it is not well anchored and can be a painful site to access. Nurses must use extreme caution when using the basilic vein because it lies close to the brachial artery and 2 nerve branches. Learning how to differentiate between veins and arteries is crucial in this training. A short video is available here. The training includes learning how to line up the probe and the underlying vein, making sure the nurse has the arrow of the probe positioned directly above the vein to be cannulated. Cannulation of the skin is visualized on the screen until the tip of the catheter is recognized on the screen. Once the skin has been pierced, the advancement of the IV catheter is stopped, and the ultrasound probe is advanced away from the insertion point. Then, the IV catheter is advanced until the tip of the catheter is visualized on the screen again. The IV advancement is stopped again, and the ultrasound probe is advanced away from the insertion point, and the IV catheter is again advanced until visualization of the tip on the screen is seen. This probe catheter advancement is continued until cannulation of the vein, or flashback, is accomplished. At this point, the ultrasound is no longer needed and the IV insertion continues as a traditional IV insertion would. The importance of this training includes a decrease in pain experienced by the patient, a decrease in cost for the patient, a decrease in the workload of the emergency room staff, decreases the need for multiple nurse involvement, and decreases the need for CVC placement. Ultrasound-guided peripheral IV training increases patient satisfaction and patient flow, it increases the skill level of the nurse, and it improves patient outcomes. In conclusion, providing a training program for emergency nurses in ultrasound-guided peripheral IV insertion is easy, safe, and feasible. Ultrasound-guided peripheral IVs can be successfully placed by emergency department nurses. The patient, the emergency department physician, the nurse, and the ER would benefit greatly from this training program. References. References continued. This is the end. Thank you.